Hello everyone, welcome back. Doctors and nurses of Reddit, what is your why didn't you come in sooner moments? Story 1. Imaging guy here. I have a million of these. I work with vascular patients and wounds. Had a guy whose foot was completely broken sideways at the ankle. He had it still wrapped from when he left the hospital. He would use the stumpy part to move around on his wheelchair and leave little blood sponge prints on the floor. Another guy with bad ankle and foot wounds decided to stop going to wound care, and was afraid to take the wraps off, even after his foot started to stink. By the time I saw him, his skin had kinda liquefied. Earlier on in my career, I saw a guy with necrotizing wounds to both legs that had eaten to muscle in multiple places below the knee. I asked him how long they looked like that, and he said about 2 years. Next time I saw him, he was bilateral above knee amp. Story 2. Former medic here. Called to a patient who had cut their leg while chopping wood about a week prior, and now it was really itchy. Old gentleman, didn't drive, lived alone. Got to his house, unwrapped the ungodly swollen leg to find that he'd tried to superglue the wound closed, and maggots had commenced growing inside. The itching he was feeling was the writhing maggots under his skin. Story 3. Guy came in with a dead leg. Waited until it turned black and then decided to head to the ER. They tried an angiogram to open up blood flow, but it was way late for that. Guy had several clots in his lungs and legs. Undiagnosed atrial fibrillation. He couldn't believe we were going to amputate, kept asking me what else I could do. My mind, go back in time, about a week ago, and then come in. Kinda around when it turned blue. Story 4. Doctor here, had a 65-year-old dude who was diagnosed with lymphoma 8 months before we saw him. He lived an hour out of the city and didn't want to drive in for treatment, so he decided he wouldn't get treated at all and stayed on his little remote place in the country by himself. Essentially, because it didn't get treated, it spread along his skin, and his neighbors called an ambulance when popping in on him. It had spread so far that it essentially went from his head to his knees. It had started to invade his eyes and mouth membranes. He couldn't drink and could barely see. His skin had started to slough off, and he was so severely dehydrated because he was losing so much excess fluid from his open skin that we had to treat him like a severe burns patient, and had plastics involvement. The consultant said if he had received treatment, there was a chance he could have recovered. Instead, he died 3 weeks later. Story 5. I was an EMS supervisor for a while, and once ran on a patient with classic stroke symptoms, sudden onset one-side paralysis. She was still able to talk, though, and insisted that she neither needed nor wanted to go to the hospital. That was why I, as the supervisor, had been called. The paramedics on the scene, good paramedics, knew they were treading that thin line between necessary transport and the patient's stated desire to not be transported. So, I talked with the patient for a little bit and ran into the same problem. So, I touched the patient's good leg and asked her if she could feel that. She said yes. Then, I touched her bad leg and asked if she could feel that. She said no. I asked her if she could tell me why she couldn't feel it, and she replied that it wasn't her leg. I knew she needed to be transported, and that reply was all I needed. I told the medics that they could transport her because obviously her mental acuity was impaired to the point that she was unable to make informed judgments on her own care. I made sure they knew that. That was the way to write the report too. And once we started to load her up, she provided no resistance at all, which is pretty much what I expected. Never got any word back on how she did, but also never had that decision come back and bite me. Story 6. When my granddad had one, his biggest concern was not wanting to go to the hospital before he put his socks on. He slowly put on one sock, got the other sock, and put it on the same foot. He realized it was wrong and took the socks off. Then, he started again, with the same result. He repeated this multiple times until we had to beg the ambulance dudes, who were standing there, watching, to just take him, regardless of if he said he was ready or not. At the time, I thought he was doing the sock thing because he was just so confused. But now, I wonder if he was doing it because he knew he had 2 socks to put on, but didn't recognize the other foot as his? Story 7. My mom had a stroke, browsing in a store with my dad and me. I just happened to go looking for her and found her sitting on the floor, next to my dad. She was a very dignified woman and would never sit on the floor in public, so I knew something was very wrong. Immediately, I started thinking stroke when I heard her start trying to speak. But the 2 things that were most astounding in the moment were, 1, how hard she insisted there was nothing wrong with her, and 2, that she just didn't recognize her left side as part of her body anymore. She was also extremely concerned about where her purse was. I can't thank the EMTs, doctors, nurses, physical therapists, medical aides, etc., who helped her in the aftermath, enough. She lived, but never really regained mobility, and completely lost all math skills before passing 5 years later. Story 8. I saw a coworker have a stroke, sitting in a chair in front of me. 1 minute, she was talking, then, she took her glasses off, Immediately dropped them, got a very confused, glazed over expression on her face, stared at her hands, and started trying to speak. All she could do was vocalize in groans, grunts, and snorts. I called 911, then tried to use our shop's PA system to page a first responder. Unfortunately, some knucklehead was singing happy birthday over the PA system. I yelled for another coworker, who, luckily, was walking past the office we were in. He sat with her, while I ran to the shop foreman and told him what was happening. I grabbed the neon flags and floodlight, then ran to the plant entrance to flag down the paramedics and get them to her ASAP. She survived, but was wheelchair-bound until she died 3 years later, from complications of the stroke. On a side note, the knucklehead on the PA eventually got fired for her misdemeanor. However, in a cruel twist of fate, the coworker who walked past and subsequently sat with the woman was, in fact, her cousin. He still blames himself, to some extent, for what happened. Story 9. Years ago, as a nursing assistant on an oncology floor, we had a guy admitted because he had an erection for several days and had lost the ability to pee. His bladder was close to bursting, and his poor junk was. Think microwaved hot dog. Really bad. But none of that was as interesting as the fact that this guy had untreated skin cancer on his nose for several years, that had, over time, become infected, developed MRSA, and spread across his face. He had no nose, no cheek, and no eye on one side of his face, and was starting to lose his other eye. You could see part of his effing skull. I don't know why he chose to leave it untreated, and I have no idea how long it took to get that bad. But I will never, ever forget the smell and texture of his rotting face. On the upside, we were eventually able to convince him to have reconstructive surgery. He ended up getting a skin graft that covered up his eye, nose, and cheek. So, if you ever meet a very grumpy dude with nothing but a mouth and one eye, know that this is way better than the alternative. Story 10. This has happened a few times, actually. But I had a gal come in on Monday after being discharged from the hospital Friday after giving birth. So basically, we tell ladies to avoid intercourse until a doctor clears you, and well, her spouse kept insisting that Friday night she caved and let him go to town. He wound up tearing some stitches that were placed and bleeding like a stuck hog all weekend long. Came into our clinic, blue in the lips and fingers, and her hemoglobin was 4, normal should be 12 to 15. She didn't want to be a bother, so she waited until she started feeling dizzy all the time. She got another trip to the hospital for transfusion and repair for that. But, like I said, this isn't the first time I've seen that, so for the love of God, if homeboy is begging for it after you just had a baby, maybe he needs a lesson in self-control and a bottle of moisturizer. Story 11. Once, had an older lady call in, wanting a prescription for pain meds, because she was sure she had shingles. She said her neighbor had them, and she was sure that's what it was. She hadn't been in for an exam in almost 2 years. So, the doctor asked that she come in to be evaluated, before a prescription could be given. She refused and called again the next day, asking for a prescription. This went on all week. Her calling for pain meds, the doctor asking her to come in to be seen. She finally agreed to make an appointment. It wasn't shingles, it was a skin ulceration from advanced breast cancer. Story 12. I spent a year going to a hematologist for severe anemia. I didn't know at the time, but there's not really such thing as a pure hematologist. They're almost always hematology/oncology, and the building was literally called _cancer center. I was exhausted all the time. My hemoglobin was 7.1, if you show up at an ER with a 7.0, it's pretty much a blood transfusion, now sort of thing. Normal is up around 11/12. A year of transfusions, iron pills, and losing a third of my body weight. A year of various symptoms, of having blood work every other week, of the doctor claiming they're testing me for everything but this sort of thing just happens to girls. Eventually went to a gastroenterologist. He listened to my history, poked my abdomen, and essentially diagnosed me with cancer within 5 minutes of meeting me. Sent me off for CT scans and biopsy and all that to confirm, but he was honest at that first meeting. Stage 4. I've been doing chemo every other week for over a year now. Because it just happens to girls, and they never once bothered to check for cancer. Story 13. Not a doctor or hospital staff, but my grandpa ended up passing away because he waited too long before going to the hospital. This was about 17 years ago. He was tending to one of his mules when something spooked it, and he got kicked in the gut. He was in a lot of pain, could barely move due to the abdominal pain, so he decided to take it easy and lounge on the couch for a week. He refused to be taken to the hospital. Unfortunately, that mule kick ruptured an unknown tumor in his intestines. The doctor said it was huge. Like volleyball size huge. And he may have survived if he came in sooner. By the time we got him to the hospital, he had a severe case of gangrene. His leg needed to be amputated within a day of him being there. He passed away a week later. Story 14. I am a doctor, and while working in OND, we had an older chap, possibly in his 70s, who, several days prior to presentation, had a sudden onset of severe chest pain and vomiting while loading the car with shopping. He ignored it and struggled home. The next day, he started to lose the use of both legs, and by the time he came to hospital, he had been crawling around his house for several days because he thought it would get better. He had had a major cardiac event, developed a clot, which his heart had pumped out. It went down his body, broke in half, and blocked off the blood supply to both legs. He literally had dead legs. I don't know what ended up happening to him, but there was no way to save the legs, and I reckon the outcome was very poor, if not fatal. Edit. Because there is a lot of USA assumption going on, this is in the UK, where healthcare is free at point of access, so, debt is not a contributing concern for our patients. Story 15. Children's nurse here. My first week in pediatric ed, we had a young girl, 6/7, come in with a really swollen jaw/face. Poor girl was unable to move her jaw without intense pain, and hadn't been able to eat for several days. Turns out, she had only just started cleaning her teeth for the first time ever, and managed to develop several abscesses and rotten teeth in the process. To make it worse, her mum told us she was recovering from the same procedures to remove most of her teeth, because of almost the same thing. They didn't want to bother the GP, as they thought she was just messing about to get out of school. Story 16. I was with my kid in the emergency department, allergic reaction, and in the waiting room, there was a family with a 2-year-old. Apparently, that kid stopped walking and lost the use of her legs 3 days before. They waited 3 days. Story 17. I got really sick, really fast, but I didn't realize it. I had stage 4 Burkitt's leukemia, CNS positive, which is very important to know. Less than 100 people my age will get that cancer each year in the USA, so, pretty uncommon. Anyway, I got super sick just over a year ago. And just happened to have a doctor's appointment scheduled. Went to the appointment and felt like absolute trash, sweaty, hot, lethargic, lightheaded, terrible heartburn, and just tired. Also, I could barely breathe. My dad, who was driving me to the appointment, had to wake me up. I remember him saying, "Get up. We have a doctor's appointment to get to. You better be effing sick." In his defense, he had no idea, and neither did I, just how sick I was, as 2 weeks before I was fine. He is working in South Carolina on a construction job. So, we get to the appointment, and I get blood work and an ultrasound of my chest cavity. The doctor saw the ultrasound photos and was stunned. Then, he saw my blood work and told me to get the F back to the hospital, as we left to go home, and would hear the results later. The doctor saw 7 tumors on my liver, the biggest, the size of a grapefruit, and the second largest, the size of a baseball, and then, he saw my blood work was trashed. Diagnosed me with cancer, and said it was a miracle I was awake, let alone walking and cracking jokes. I only found out later that Burkitt's cell can double in size within 24 to 48 hours. Doctor wondered, why hadn't I had problems with my tumors before? Since I only scheduled the appointment to fix heartburn. Story 18. I was sitting in a hostel with an emergency nurse and an emergency doctor, who had just found out that while they worked on different continents, they did similar work. We were happily chatting along when, suddenly, this older guy walks in. He overhears that they're in the medical field and comes up to see if he can ask a question. He shows them his leg, that's got large black spots on it, everywhere below the knee. Both the nurse and the doctor look at it and immediately go, "You have to go see emergency services. That leg is necrotic, you'll lose the leg if not your life." And the guy goes, "Ha. That's what my doctor back home said, too. But the leg feels fine, I'd know if it was dying." You are wrong. Besides, I'm not gonna ruin my vacation by seeking medical treatment. Which left me wondering why he asked in the first place. He goes to sit at the bar, and over the course of the evening, both the nurse and the doctor left the table to try to get this guy to understand that he may not have 10 days until he's back home, that he needs to have this looked at now, without success. Story 19. My dad was a doctor. This is somewhat relevant to the rest of the story. In HS, I played basketball. One day at practice, I was going in for a layup and got knocked by a teammate as I went in, and ended up going into the wall under the baseline pretty hard. With my hand in a really awkward position as it hit, it hurt. I finished practice, barely being able to pressure the ball. I went home, had my dad take a look, because I felt like it was more than a typical hand sprain. He ran me through the paces quickly and said that it couldn't be broken, because I wouldn't be able to handle the test without screaming if it was. Okay, no problem. Just a nasty sprain. I practiced and played for the next 2 weeks, in pain. After one game, I told my mom, on the way home, that my hand hurt really badly and I needed to get to a doctor. Well, one x-ray later, and it turns out that I hit at the angle that caused a break in my hand from it. And I played with a broken hand for 2 effing weeks because of it. So, Cast on the hand. Season gone, because of a broken hand. All good, right? Nope. Turns out that the result of playing with it broken also pinched and killed a vein in the neighboring finger. So, when I complained that my hand was still hurting 6 months later, we went to the surgeon, and I had an avascular necrosis of the knuckle joint. So, I had to have the bone scraped out, and new bone grafted in, to keep the finger. Also, no more football at all, because the weakened joint could be easily crushed, and that would require amputation. Sometimes, you need to trust that you are right when your parent, doctor, tells you your hand isn't broken. Edit. Since there have been a couple of comments confused, I injured it at basketball practice. Post-final surgery, I was told I could no longer play football, which was my main sport, and potentially could have been a ticket to college for me. I was a starter on every squad at my school, however, the hand was too damaged to risk continued play. I was able to keep playing basketball after that, but I did end up stopping because I could no longer shoot well due to the changes in my hand. Story 20. My cousin is a pathologist assistant, and was telling me about how she had to dissect a testicle that was 11 pounds. Turns out, it was testicular cancer. Story 21. Patient here. For 6 months, in 2014, I complained to my family doctor that it felt like I swallowed a super ball. It had gotten stuck. Walking to the mailbox and back caused me such labored breathing that I needed a 10-minute break to catch my breath. I was also coughing up quite a bit of blood from time to time. He was getting annoyed by my complaining, and would just keep prescribing steroids. He told me that, because I was fat and a smoker, I needed to accept that I had COPD, and that was going to be my life from now on. I finally said, look, send me for whatever type of test will look that far into my throat, and if it comes back as nothing, I will stop complaining. 3 weeks later, I had a sonogram, and they asked me to stay for another test. Then, they started freaking out and said I had to go from the testing facility to the ER in an ambulance. Their hospital refused to see me, so they sent me to a different one that also refused to see me. We still had no clue as to what was going on. I finally get taken to my current hospital/medical center, and they told me I need emergency surgery to try and remove the cancer tumor that is growing inside my airway. I only had 4 millimeters, a coffee stirrer, to breathe through. Had I not made that deal, and had just accepted that not breathing was my new normal, I would have only lived another week or two. My family got a new family doctor. I was diagnosed with terminal stage 4 cancer, throat, lungs, and spine, in April of 2015. I am losing my fight, though, and started home hospice 2 weeks ago. I put up a good fight, and I am so thankful that I didn't die in 2014. Story 22. I was working as a surgical junior when my team was called down to see a patient who had come in with a complication from a recent hernia operation. When we came down, we saw that the patient was holding a plastic bag over their abdomen. When this was removed, we found that their wound had opened, and their intestine was visible to the air. It transpired that this was not something that had happened overnight, it had taken several days. The patient had started using plastic bags and newspaper to dress the wound when they ran out of dressings. Edit. Addendum. I must stress that this case was exceptionally uncommon. It is an example of what happens when someone does not seek medical attention when it is obviously required. In general, hernia operations are very common and very safe. That being said, if you have any surgical procedure and you are not certain the wound is healing properly, you must seek medical attention. Story 23. Not a doctor or nurse, but worked as a doctor's office assistant. A regular patient, who was very sweet, but unfortunately had an ongoing battle with alcoholism, was brought in by his roommate, and I knew instantly that he would be dead soon. I'd seen some jaundiced humans in my time there, but this man was a yellow I never knew was possible. His roommate said, through tears, I've been telling him to come in for weeks. And the patient kept telling the roommate to relax, that he was fine. Majorly in denial. I helped him to the exam room, and when the doctor entered the room, he immediately asked me to go call an ambulance. A few weeks earlier wouldn't have helped, but perhaps the end could have been made a bit easier for him. He died 7 days later in the hospital. Hit me very hard because I'd known the guy for a few years. Sometimes he would be sober when he called, and sometimes he would be slurring and completely incoherent. But he was always kind. Story 24. I read medical records for a living. I had a case where a young man kept coming in for frontal headaches. His doctors tried all the usual remedies for migraines, but his headaches persisted. Then, he developed a runny nose that wouldn't quit. Eventually, they realized it was cerebrospinal fluid. They did a CT scan of his brain, normal. Eventually, someone decided to get imaging of his sinuses. They found packing material in his left sinus, left over from a sinus surgery he'd had more than a year before. It had rotted and eaten through some structure, his nasal passages? I can't remember. Story 25. Not a doctor, just a student shadowing. During the pandemic, a guy with a history of heart issues had a heart attack, with classical chest pain. Then, He had symptoms of heart failure, which he recognized, because it had happened to him before. But he still waited a few days because he was worried about coming to the hospital during the pandemic. Finally, it got so bad, he couldn't breathe from the fluid backed up into his lungs, that he came to the ER, when he was obviously hospitalized. My professor also said he recently had a patient with an aortic aneurysm who was misdiagnosed because she only had a telehealth visit, no imaging, due to the pandemic. She ended up with an aortic dissection. Edit, she was first seen at an outside hospital, but went to our institution for a second opinion. She did all the right things. The outside hospital made the error of not doing imaging. Story 26. Not me, but my brother is an EMT for a warehouse. He recently had a guy come to his station, saying something was wrong with his toe. So, he asks him to take off his shoe, which he does. My brother was about to ask him to take off the bandage around his big toe, before he realizes that it wasn't a bandage, it was his skin. Apparently, this guy dropped a 20-pound toad on his toe a week earlier and had been showing up at work anyway. They sent him to the doctor sent him to the ER. Diagnosis came back as a tissue infection, as well as osteomyelitis, a bone infection. But wait, there's more. The guy came back from the ER and told him that he didn't want to go through the ER doctor and would rather go through his own insurance. My brother explained to him, as best as he could, that, as it stood, he was already likely going to lose his toe, and if he waited any longer to get it treated, he ran the risk of losing his entire leg. Not sure what happened after that, I just hope he got the point. Story 27. I had a patient come in saying he couldn't see. How long had it been going on? For 5 days. The man had been blind for 5 days and didn't come in because he thought it might be like a cold or something. During the exam, when I asked him to move his legs, he said, "Oh, I can't do that." I asked how long he'd been unable to move his legs or walk. Wife chimes in, about 2 years. Never saw a doctor about it. They just borrowed a friend's wheelchair and kept it rolling. Turned out he'd had multiple strokes, with multiple risk factors he never addressed. Given how little insight he appeared to have into the condition, I honestly felt sorry. He didn't have insurance, so I'm sure that played a role in him avoiding seeing anyone. Story 28. Okay, I'm not a doctor, I'm the genius who didn't come in sooner. When I was a teenager, I thought Converse were the it. Even though the pair I bought were pretty cramped in the toe, I used them all the time for PE. Here is where things started to go wrong. I started getting an ingrown toenail, and instead of taking care of it, I just tried to cut the nail out, and ended up with this puffy, red, angry, shooting pain in my toe. Then I noticed some wetness in my shoe, it's puss. What do? Buy a new pack of socks for the next 2 weeks. Week 2, I wake up and my foot is on fire. I look and it was half red, half purple, and puffy to the touch. I go into urgent care with my mom, who I don't show her the foot, just that I think I need it looked at. Doctor comes in. Yay, I'll take a look, but we don't do ingrown toenail extractions. I'm sure it's not that bad. I take off my shoe. The smell. My mom turned white and had to sit down, as she fell into a literal litany of non-stop prayer. The doctor says, that is the most infected thing I've seen in the last 10 years. I'll grab the kit, we need to get this toenail out and put you on serious antibiotics now. Story 29. Nurse here. I work in a very rural hospital, and we have a patient population that seems to avoid the hospital at all costs. I have had so many, usually related to diabetics with foot sores, almost always resulting in amputation of a toe, or more. However, my favorite was an elderly farmer who came in with chest pain that wouldn't go away. As he put it. When we asked him if he had it before, he had said that he had been having chest pain, on and off, for years, but it would typically go away after he grabbed his electric fence. Apparently, the first time he had the pain, he was standing out near an electric fence on his farm. He reached out to steady himself and accidentally grabbed the electric fence, which shocked him and made the pain go away. So, after that, whenever he would have the pain, he just went and grabbed the fence, and it made him feel better. He had literally been cardioverting himself for years. He was fixed up and sent on his way, but we all still chuckle about it now and then because he was so nonchalant about it. Story 30. Not a doctor. But was this patient once? My sophomore year of college, I started drinking coffee. And, as college students can be wont to do, I drank a lot of it. One evening, during midterms week, I get a bad headache. So, I drink some coffee and settle in to churn out a few hours of work. My headache goes away, but I start noticing tingling and numbness in the right side of my body. It eventually gets bad enough that I can feel the line down my face where the tingling ends. My whole right side is totally numb. But I think it's midterms week, and I probably just need to sleep it off, and it'll be fine, right? So I go to bed, wake up for my 8 a.m., and the numbness is all worse. Eventually, at like 10 a.m., I finally asked a friend to drive me to the ER, The ER doctor was horrified that I had ignored a very obvious sign of a stroke for at least 12 hours. It ended up being a complex migraine brought on by, essentially, a caffeine overdose and sleep deprivation. I adjusted parts of my lifestyle, including monitoring my coffee intake, and I haven't had a repeat episode. Story 31. Had a guy show up in my clinic one day with a complaint of finger swelling. So, as the story went, his finger got swollen and painful about a week prior. It just got worse and worse. And about 3 days prior to coming, a hole opened up in the tip of his finger. This is where I, personally, would have noped right to the office. So, come the day of the visit, he says, "By the way, I pulled something out of the hole in my finger yesterday with a pair of tweezers, no idea what it is." I asked him if he took a picture or kept it, and he produced a tissue from his shirt pocket. It was his distal phalanx, read, last bone in the finger. The bone had gotten infected, and the body did its thing and basically tried to eject what was now a hot, foreign body. The guy pulled his fingertip out of his fingertip. A better magic trick, I have not since seen. Story 32. I had an ex who had what looked like a nasty pimple on his thigh. I'm not in the medical field, but all my friends are, and I enjoy the subject. Also, another ex had an abundance of staph and had gotten at least 6 staph infections during the time we were together. So, I instantly recognized that this was not just a pimple, but an infection. I told him not to mess with it, that he should draw a line around the redness, and go see a doctor to get antibiotics. He didn't listen. Of course. That night, he tried popping it. It didn't pop, so the genius that he is decided to get a pin and try to pop it that way. Well, that was probably the worst thing he could do. The next day, his leg was looking really infected. The redness had grown a lot, and now it was like an angry red, and there were some parts that looked blue/purple. There was also now an open wound about the size of a quarter. I told him to go to the doctor immediately. Nope. The day after that, he woke up with a 103-degree fever and collapsed in front of his parents while attempting to ask them to take him to the hospital. He was admitted and on 3 different kinds of 4 antibiotics. When I visited him, the redness was almost completely wrapped around his leg and was still growing, and the wound had tripled in size, and the area around it was black. They thought he had MRSA, since it was resistant to antibiotics, but it was aggressive. By the 3rd day in the hospital, the redness was wrapped around his thigh, covering almost his entire thigh. He ended up needing surgery to try to help deal with the infection, since the wound itself was necrotic and spreading. He had the surgery, and they did labs to find out what it was. Turns out it wasn't staph at all. It was strep. Necrotizing fasciitis, or flesh-eating disease, to be specific. Had he gone to the doctor when I said, and not introduced more bacteria by sticking a pin and using tweezers on it, he wouldn't have had to go through all that. That's it for now. See you in the next post.